Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is the Minister of Health, Tyler Shandro, who will provide opening remarks.
Thank you. And good afternoon, everyone. We know that testing is crucial to winning the fight against COVID-19. Timely and accurate testing lets our health system identify cases quickly. The system can then act swiftly on that information, preventing the infection from spreading widely. That's why today I'm pleased to announce that more than 1 million Albertans have now been tested for COVID at least once. This is a big number and a remarkable accomplishment for our healthcare system. Remember that before COVID arrived in Alberta, our provincial labs had the capacity to run at most a few hundred COVID tests per day. Since then, we've developed the strongest and most dynamic testing program in the country. While other provinces have faced massive lineups or consistently narrow testing criteria, Alberta has been a leader. Before the virus had even arrived in Canada, Alberta Health Services and Alberta Precision Labs were ordering additional supplies and preparing for the challenge ahead. Alberta was also among the first to open up testing to all travelers. We were the first to offer asymptomatic testing and the first to work with community pharmacies to expand capacity throughout the province. Alberta now has conducted more tests per capita than BC, Ontario, or Quebec. We all should be proud of what our labs have accomplished. Of course, every test is the result of a lot of hard work, and I want to recognize the public health officials at AHS as well as Alberta Precision Labs who have worked around the clock to protect Albertans from COVID. Your dedication, your ingenuity, and your expertise are the reason that roughly 1 in 4 Albertans have now been tested, with more being tested every day. I also want to thank every Albertan who has been tested for COVID. Thank you for doing your part to protect yourself, your loved ones, and your community. Albertans have always stood together to support their neighbors, and we have all played a role in reaching this historic milestone. Now, COVID is still here, and Alberta's government will continue to work to strengthen our lab systems as we move forward. We're working to reduce wait times and speed up test results. We're also looking at new ways to conduct testing or expand capacity further to prepare for the winter ahead. And we're working to ensure that Alberta remains a leader and that we continue to do everything possible to protect Albertans from COVID. Your health is and always will be our top priority. I'd like to now ask Mauro Chiez, the board chair of APL, to speak more about our remarkable lab system, and then we will all hear from Dr. Hinshaw. Mauro.
Thank you, Minister Shandro. On behalf of the more than 5,000 employees at Alberta Precision Labs, and as well as many other AHS dedicated staff that are involved in the COVID testing, we appreciate being recognized for this important milestone. Our integrated provincial lab system under Alberta Precision Labs positions Alberta very well to provide a rapid scale-up testing component. And as the Minister said, a short while ago we were only doing 300 tests a day on average, and now we're averaging about 13,000, with an incredible milestone of a one-day record of over 18,000 tests not that long ago. Critical to reaching this milestone has been the enormous effort and dedication of our frontline staff and the leadership of APL, and they've shown throughout the pandemic, and it's no exaggeration to say that they've been working around the clock to source the necessary supplies and samples, expand our capacity for sampling patients and processing tests. It is their hard work by stepping up with overtime, extra shifts, being flexible, willing to do things differently, that has made a huge difference in this battle against the virus. We know that the hard work is far from over. APL and AHS continue to pursue innovative approaches across the province to expand testing capacity and reduce our turnaround times for COVID-19 testing. Collaboration between all of our teams continues for the health of Albertans. We are proud of our teams and of Albertans who are working with us and each other to keep each other safe. Thank you.
All right, we'll now turn it over to Dr. Deena Hinshaw, coming in via video conferencing.
Thank you, Tom and Minister and Morrow, and good afternoon, everyone. As you can see, I'm providing my part of today's update from home. I felt well on Thursday, but on Friday I developed a sore throat. As I have said many times, it is important to stay home when sick and get tested, even if the symptoms are mild. As a result, I was tested over the weekend and have a negative COVID result. Despite this, I don't want to pass on whatever it is I have to others, so I'm working from home until my symptoms resolve. I acknowledge that I have the privilege of working in a job that can be done remotely, which not everyone has. I know that staying home is not easy, and that many Albertans face difficult financial or other choices. Most of us have worked with sore throats or runny noses many, many times. However, during COVID, that's not a risk that I or anyone else should take. Do not risk exposing others if you are sick. This is part of our new normal, and I recognize that staying home is inconvenient. However, it is also part of how each of us can protect our families, friends, and co-workers. Turning to today's update, I would like to review the weekend numbers and the outbreak at the Foothills Medical Centre, and then talk briefly about herd immunity. There are currently 63 people in hospital in Alberta, including 15 in intensive care. This number has risen somewhat in the last week, due in part to the outbreak at the Foothills Medical Centre. However, these numbers are still well within our health system's capacity. We continue to identify cases in all parts of the province. The total number of cases grew by 60 on Friday, while our lab conducted more than 16,000 tests. This lower number is the net difference between Thursday and Friday after adjusting for previously clinically reported cases. On Saturday, the lab again conducted over 16,000 tests and we identified 184 additional cases. Finally, 162 new cases were identified yesterday, while more than 18,500 tests were conducted. There are currently 1,549 active cases in the province, which is 52 more than on Friday. Turning to schools, as of today, AHS has confirmed that 20 schools that previously had alerts have had no transmission, and students and staff are all now back in class. There are active alerts or outbreaks in 113 schools, which is about 5% of the schools in the province. There are currently 210 active cases in total at all of these schools. This includes 47 schools which are on outbreaks, including 6 that are currently on the watch list. As always, I want to remind everyone that although 2 confirmed cases in a school may qualify as an outbreak, this does not mean that the school is unsafe. In fact, of all these alerts and outbreaks, there are only 9 schools where in-school transmission has likely contributed to 1 or more of these cases. However, we are being cautious and ensuring swift measures are taken even when only a couple of cases are identified. Sadly, I must report there have been 4 additional deaths from COVID since Friday. I know that people who have lost loved ones during this pandemic to COVID or to any other cause have had to grieve in different ways than we are used to. My thoughts are with everyone who is grieving the loss of a loved one now. One of the deaths reported over the weekend was a patient at the Foothills Medical Centre. This outbreak continues to be a significant concern, and a great deal of work is going into preventing any ongoing spread. 2 additional units are now under outbreak protocols. One is a transitional medical unit, where a case linked to an outbreak unit has now been identified. The other is a short stay unit, which is not linked to the other outbreaks, but has a single case whose source is unclear. Although the source of this single case could be community transmission, as a precaution, the unit has been put into outbreak protocols. This outbreak now has 53 cases in total on all units that are affected, including 26 patients. Sadly, 4 deaths have now occurred. AHS is working hard to support patients and staff, and I have been assured that outbreak protocols are in place on all affected units. While aggressive measures are being taken due to the long incubation period of this virus, it is likely that we will continue to identify additional cases in the days ahead. What is critical is to prevent any further onward spread or exposures, which is the focus of AHS's efforts. As an added safety measure, visitation to the entire site has been temporarily limited to end-of-life or pre-approved essential visitors only. AHS has also rescheduled 39 surgical procedures slated for today at the Foothills Medical Centre. All postponed surgeries are being rescheduled as quickly as possible, with many of them already rebooked within the next 7 days. There is also an outbreak at Millwood's Shepherd's Care Centre that is of concern. There are currently 19 cases linked to this outbreak. Sadly, 2 of the deaths over the weekend occurred in residents at this facility. AHS is working closely with the operator to support them and ensure that the proper outbreak protocols are being implemented. AHS staff are on site and meeting virtually to provide direction, consultation, and support. This includes a quality monitoring visit, which is standard practice for all sites on outbreak. Testing is being offered to all residents and staff, and I've been assured that all necessary steps are being taken to limit future spread. With these outbreaks in mind, I want to talk about herd immunity. I have heard several comments and questions lately about herd immunity that I would like to address. For those who aren't familiar, herd immunity is what happens when there are enough individuals with immunity in a population to prevent an infection from spreading widely. The percentage of immune individuals needed to make this happen changes depending on the specific infection. For COVID-19, estimates of this percentage range from 50 to 70%. And serology studies in Canada have estimated that we are only at about 1% or less of our population who have been infected. What I have heard sometimes suggested for COVID-19 is that because younger people are generally at low risk of experiencing severe outcomes, we should protect older Albertans, but otherwise let the virus spread as quickly and freely as possible so that we can build up a collective immunity to it. This suggestion, however, does not take into account the drawbacks of this approach. It is true that COVID-19 is rarely fatal in young people. In Alberta, the risk of death for a person diagnosed with COVID-19 is about 18% for those over 70, less than 0.5% for those between 40 and 69, and vanishingly small for those under the age of 40. It is also true that public health measures that have been in place to prevent COVID-19 spread have risks and health impacts of their own, and we need to do our best to keep in place only the measures that are needed. However, let me explain why I believe a herd immunity strategy is not the right approach. First and foremost, it's important to remember that COVID-19 is able to spread rapidly, and we are all interconnected. Adopting a herd immunity approach would have a serious and deadly impact on many people in the population. Even if we could put perfect protections in place for those who live in congregate settings like long-term care, while letting the virus spread freely elsewhere, we cannot simply dictate where and how the virus will spread. The more community transmission that we see, the greater the risk of it spreading to older and at-risk Albertans. In Alberta, about 30% of those over 80 who have been diagnosed with COVID-19 and who live in long-term care have died. For those over 80 living in the community, it is 18%, lower, but still very high. The lives of people with chronic conditions and our elders are very important. Adopting an approach focused on herd immunity would place many older Albertans or those with underlying medical conditions at risk and lead to many more deaths across our province. Our only protection from COVID-19 is each other, and we all share the responsibility of protecting our communities and our fellow Albertans. The second reason that this approach is not right for Alberta is that death from COVID-19 is not the only severe outcome. In Alberta, over the past 7 months, 1 in every 67 people between the ages of 20 and 39 diagnosed with COVID has needed hospital care. That rises to 1 in 18 for those aged 40 to 69, and 1 in 4 for those aged 70 and over. If we let the virus spread freely, our health system could be overloaded in caring for COVID patients, which would challenge our ability to provide all the other health services that we need. Babies are still being born, car crashes are still occurring, and our health system still must support Albertans in countless other ways. We have seen this overload happen in other countries. We do not want it to happen here. Finally, it's important to remember that we still don't know if being infected with COVID-19 actually confers any robust or long-lasting immunity. This means the costs of widespread transmission, the deaths and risks to so many Albertans' health could be for nothing. We would put our elders and those with chronic conditions at risk, increase the burden on our acute care system, and still may not get the collective protection that this approach was designed to achieve. Given that, what is our best path forward? First, we must rely on science. A great deal of research around the world is underway to find effective treatments and a safe and effective vaccine for COVID-19. Ultimately, both of these is an end game that returns us to the world we want to live in. Second, as we wait for treatments and vaccines to be discovered, we need to find a balance between preventing the harms of COVID and preventing the harms that strict restrictions can have on the rest of our health. This balance is delicate and dynamic. It will need to change based on what we see and learn, and we can only accomplish this together. Our collective action is the key to protecting one another both from the risks of the virus and risks of strict restrictions. We are all in this together, and that's a good thing because we are strongest together. Thank you, and we're happy to take any questions you may have.
All right, we'll go to the phone now. We have Minister Shandro, Dr. Hinshaw, and Mr. Kies from APL, all available for questions. Please refer to a specific individual so we can make sure you are getting the answer you need. Operator, could you put through the first question, please?
Thank you. The first question is from Julia Wong, Global News.
Julia?
Hi, this is a question for the Minister. Are there plans similar to Ontario to hire more nurses and other healthcare workers in anticipation of a possible second wave, or at least to ease staffing shortages at hospitals with outbreaks? And also, what continues to delay Alberta in joining the federal tracing app? We were last told that the province was awaiting details from the feds to transition accounts. So what's behind the holdup weeks later?
Sure. Well, first I'll say this. AHS, starting back in January, before the epicenter of COVID had come to North America, AHS did an amazing job at building up, as a part of this announcement, right? Just let's remember back in March, as I said in my remarks, that the testing capacity that we had was only hundreds of COVID tests per day. And it was because of their foresight in building up the equipment capacity, the supply capacity, but also the workforce capacity. And that applies not just to the workforce capacity in our labs, but also the workforce capacity throughout AHS. And so AHS has done a remarkable job to be able to do that, to make sure that we had the workforce and that we will continue to have the workforce necessary going forward. So I thank them for all of that work that they've done to make sure that we had that preparation. Now, regarding the federal app, look, I spoke to Minister Haidu, I think it was last week. I think there were still a couple of issues, still a couple of questions that were remaining to be answered, and but happy to continue to work with her and her team at Health Canada to be able to make sure that Albertans have the ability to ensure that not all of our contact tracing in Alberta is just the manual contact tracing, that we are going to supplement our contact tracers with the ability to have something like a tracing app. Thank you.
Operator, can you put through the next question, please?
Yes, the next question is from Jesse Weisner, Global News, Calgary.
Hey, Jesse.
Hi, this question is for Dr. Hinshaw. What are your expectations for the flu season? Some other countries who are in or have gone through their season say it wasn't very bad because of all the precautions already in place. And are you expecting the same kind of thing?
I will say the same about influenza season as I would say about predictions forward for COVID, which is that really depends on Albertans, and that future is in our hands. We have seen in places like Australia that they had a very high uptake of influenza immunization, and that combined with COVID restrictions meant that they had a fairly mild flu season in terms of the number of cases. And that could be what we see if we have the same kinds of conditions. So if we continue to see people following our public health restrictions. And if we do get a high uptake of influenza vaccine, then it's possible we could see a mild influenza season, but that entirely depends, again, on the choices that we make collectively and our abilities to prevent the transmission of infections, whether that be COVID or influenza.
Operator, can you put through the next question, please?
The next question is from Sean Frenette, CTV.
Hello, Dr. Hinshaw. I just wanted to ask you about how would you rate your level of concern about the outbreaks that are ongoing at the Foothills Hospital? We just got an update from AHS that the numbers have grown. Visitor restrictions there are now deeper. Basically, you can't get into the hospital to visit unless you're in an end-of-life situation or have special approval. How concerned are you that we are getting closer to perhaps the situation we had at the Misericordia in Edmonton in an earlier outbreak, that we might have to shut the hospital to all new admittances, especially considering that the Foothills is such an important hospital for all of southern Alberta?
Of course, the outbreak in the hospital is concerning, as it would be in any acute care centre, but as you say, the Foothills in particular is a very important acute care centre. What I would say is that I talk regularly with my colleagues in Calgary and have been talking with them about this outbreak and the steps that are in place to prevent any further transmission. It's my understanding that many of the cases that have been identified are the result of very aggressive contact tracing and moving back to understand who may have been at risk from being on the unit that's most affected while there was potentially transmission taking place. And so many of the cases that have been identified, that exposure happened several weeks ago, and identifying those cases is actually the best way that we can stop ongoing future transmission. Of course, it's concerning to see a couple of additional units impacted today. However, again, understanding that I have based on conversations with my colleagues is that part of that is due to that very aggressive contact tracing and regular testing of anyone who may have been exposed, so we can identify cases as quickly as possible and prevent any further transmission. So while, of course, the numbers are concerning, the information I've received indicates to me that there is a very capable outbreak team who's doing a tremendous amount of work to prevent there from being any onward spread. And one of the differences between the current outbreak and what was happening when the Misericordia Hospital, when the decision was made to have that hospital closed, is that at a particular point it was not clear where all of the cases in multiple units at the Misericordia, where they were all linked back to, whereas at the Foothills, my understanding is there's a fairly clear linkage between the majority, if not all, of the cases that have been identified. And so at the moment, I would say, again, I have confidence in the team that's managing this outbreak. It is, of course, having an impact on patients and their families and the staff. And again, my sympathies to all those who are impacted in multiple ways. And yet I do believe that the right things are being done. And while we may see more cases as a result of that aggressive contact tracing, I'm confident that Alberta Health Services is managing this very proactively.
Operator, could you put through the next caller, please?
Yes, David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. Since July, confirmed cases at least, have gone up in Alberta. We seem to be having more since July. But at the same time, deaths have gone from 75 in the month of July, and by my latest count, I'm not sure if this is accurate, but about 14 so far in September. So a significant drop in the number of deaths. And I'm wondering if there's some kind of change, if we can make anything of this, or if there's been some kind of change in the care or treatment therapeutics for patients who are in the most dire straits from this disease that is dropping the death rate.
It's an interesting thing, and it's been observed in a few places that overall what's being measured at a country level, there seems to be a lower overall fatality rate. But if you look at the age-specific fatality rates, that's where I'm not sure there has been much change. So of course, we have had increased numbers since July, and some of the deaths that happened in July were deaths in significant long-term care outbreaks. And what I would say about overall numbers of deaths is that's driven almost entirely by who is being infected. So when the majority of our cases are in an age range that's in a sort of 20 to 39 or even 20 to 49 age category, we wouldn't expect to see a very large proportion of those cases. In fact, very few of those cases would be likely to go on to experience that most severe outcome of death. So part of what's driving the lower numbers, the lower fatality rate, is actually that we have seen a large proportion of our cases over the summer in a younger age group. As we're moving into the fall, of course, we are seeing a couple of these concerning outbreaks. I mentioned one in the long-term care center, of course, the other at the Foothills Hospital. And if we do see older individuals getting infected, we would expect, unfortunately, that they would have a higher risk of death. So while we do know more about treatment, and there are some promising therapies that can help with easing the condition of those who are most severely impacted, we don't yet have a cure or a therapy that's guaranteed to work in all patients. So we do need to maintain caution. And again, part of why that overall fatality rate is dropping is about who has been infected, not necessarily that the virus itself has changed or that our treatments, while of course they continue to improve with evidence, we don't have a guaranteed cure yet.
Operator, could you put through the next question, please?
Yes, the next question is from Lauren Krugel, Canadian Press.
Good afternoon. I think this might be for the representative from the laboratories or for the minister. Just wondering what the plans are for the winter when it comes to the drive-through testing. I can't see, those tent setups working particularly well in -30. So what sort of plans do you have in place for the cold weather and the drive-through?
Yeah, thank you for the question. So we're looking at alternate facilities. We're also looking with other providers that can have sheltered components for the staff rather than the tents. The tents worked well, obviously, through the summer months, but they were hot as well, so the staff endured some extreme temperatures there as well. But we are looking at other facilities where we're going to have safer, more enclosed areas to make do for the elements, so we should be having those out shortly.
And Lauren, it is Mario Kies, Board Chair of Alberta Precision Laboratories. Operator, could you put through the next question, please?
Yes, Andrew Walker, 88.1 FM.
Hi, this is a question for the minister. You touched on expanding testing across the province. How soon will counties be able to get this testing that's closer to home so that folks won't have to go to Edmonton?
Well, thank you. And maybe I will ask Mauro to come back up to supplement this answer, but we are aware of our small urban and rural communities and the access they have to these sites, and so it is a focus for us to continue to improve that access. But Mauro, do you mind speaking a little bit more about that?
Thank you. So I think many are aware that our partnership with Shoppers Drug Mart has expanded to collection facilities throughout the province so that we're not sticking to the larger urban centers or the rural centers. I think combined with Shoppers and some of the other pharmacies, we have over 230 locations. So what we're going to do to enhance that so patients can stay in their own community is we're going to be enhancing our courier routes. So we'll have vans going a lot more frequently to these different centers so that we can speed up the testing and bring it to the large urban centers where they're tested. We do have some rapid testing available in regional centers throughout the province. These are more lower volume devices, and they'll look after more of our critical needs for more rapid testing. But we think enhancing the courier routes and expanding the number of locations that Albertans can go to will certainly provide better access for them.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Yes, the next question is from Gil Tucker, Global TV.
Hello, this is for Dr. Hinshaw. I just want to talk about Halloween for a second here. Saskatchewan has come out with guidelines about safe things you can do to make safe Halloween trick-or-treating and all that. What are you looking at as possible measures that you would recommend for people to stay safe while trick-or-treating?
Thank you for that. We are working on a guidance document as well. As you note, there have been documents released by different organizations in different provinces, and we are working on our own. I suspect it will be quite similar to many of the others, but looking at ways that people can both have fun this Halloween as well as stay safe. And so I know there have been suggestions, and some things that are included in our guidance are things like using a candy chute, or candy slide, making some kind of a device where the person who's giving out candy can put it at the top of the slide and the child can have their bag at the bottom. So there's a distance between them, but the candy can still be provided. So that's just one example, but we are wanting to support people to have a fun Halloween, but also a safe Halloween. And so again, there's a range of different options that are suggested that can achieve both of those goals.
Operator, could you put through the next question, please?
Yes, Adam Troy, 770 CHQR.
Yeah, hi there. This is a question for Minister Shandro. Minister, you said that savings in budget and improving patient outcomes was a reason for consolidating 911 and EMS dispatches. Mayors and councillors across the province say they have yet to see proof there is a dearth of evidence for this decision. Just wondering, which is it for this? What's the reason for these changes to EMS dispatch, and will you be providing further proof for these mayors and councillors?
Sure. Well, thank you for the question. So first, I'll say this. EMS was integrated into our hospital system, into AHS, over a decade ago, and that did include dispatch. And now what's happened is, over the last 10 years, that 4 municipalities have had their dispatch contracted out to them by AHS. AHS has made the decision to take these last 4 remaining municipalities to integrate them back into the into AHS. And they've identified 2 reasons for that. One is because AHS is borderless. You have a seamless integration in how EMS resources are dispatched throughout the province. They're able to see on a broader scale all of the resources throughout the province. And the second reason is as well to integrate the oversight that physicians might have in the dispatch system to help improve how ambulance resources are dispatched throughout the province. So those are the 2 reasons they identified for that. Those 4 communities, Lethbridge, Red Deer, Fort McMurray, and Calgary, those mayors met with me last week, and they provided me with information. I told them that I would look at that information they gave me before AHS proceeded to continue with these plans. And my number one goal is, if the evidence shows that response times would somehow be adversely affected, then I'm going to be against it. But that's quite frankly not the evidence I've seen right now from AHS. But I have committed to these mayors that I will look at that information that they provided last week. But look, I think any change that we make to emergency health services, including EMS, has to be about making sure that we're improving the care that patients get in the time that they need it and where they need to go then afterwards. And that's my commitment to Albertans when we make this decision on whether or not to overrule AHS on this procurement decision.
All right, Operator, could you put through the final question, please?
Yes, thank you. The final question is from Rafi Bouchikanian, CBC.
Yes, hi there. The question is for Dr. Hinshaw. So we're almost at the end of the NHL bubble experiment, and I was wondering if you could tell us what you think went well with it and what are some lessons learned for the next time Alberta hosts a sports tournament, since we're going to have at least one more of these with the World Juniors in December.
Thank you for the question. And I think one of the really key things that we saw in this process of having the NHL decide to come to Edmonton as one of the host cities was the importance of really close collaboration with an organizing group and public health, that we were able to work in advance, that we were able to set out protocols that would protect public health, as well as providing advice to what would keep the players and staff in that tournament safe. And that really close cooperation and communication so that all different parts of that tournament proceeded with the ongoing efforts of all of us to make sure that we were, again, all communicating regularly about developments. I think that the ability to have a strict bubble that was enforced, combined with testing that was done, I think those were all things that worked well. The ability of private pay testing, to have those tests not a part of our public system and not contributing to any of the wait times in the public system was helpful. And so I think those are all the things that we're looking at, whereas we have other groups that are interested in doing a similar version of competitive play. And of course, we want to make sure that we are continuing to give our best public health advice, and our number one priority for any event will be that it would not jeopardize the public's health, but also that we're able to utilize the information we have about COVID-19 to structure a safe playing environment for everyone who's involved.
Thank you all for joining us. Dr. Hinshaw will provide another update on COVID-19 on Thursday. Have a good day.
Thank you, Tom. Thank you, Dr. Hinshaw.